take you through a few things to get you to change your thought process a little bit if you're suffering with autoimmune disease. I'll share a little bit of my story as well. And then please, as always, like the video if you like it. Share it with somebody else who needs to hear this information. Please feel free to share. If you want to get more information, follow me on Facebook, Dr. Kelly Felmer of Discovery Health. And you can also go to my website, drkellyfelmer.com. You can sign up for an email list there as well, where I repost some articles and videos. So, what your doctor doesn't know that can start you to heal. Let's get started. The first thing that we have to get out in the open is what autoimmune disease is not. Okay, this little cartoon hits it home really well. If you look up autoimmune disease, or when you were first diagnosed, you were probably described by your doctor or maybe the rheumatologist that it's just the body beating up itself. It's attacking itself and nobody knows why. Well, I don't believe that. That's not really 100% true. There's always a reason why. Your body doesn't make mistakes. There's a reason it started to attack something. And that's what we're going to talk about, because that's the life-changing thing that's going to make the biggest difference. So you have to understand, wrap your brain around that autoimmune disease is not the body making a mistake. It's not one of your cells holding a gun to another cell saying, I hate you, I'm just going to kill you now. There's a reason for it. Once you grasp that, then the things that I'm going to tell you at the end of the talk tonight are going to make a ton of sense. You're going to have a lot of value in them because those are the causes. They're the triggers. That's what we'll get to. Why? We want to get to the why you have or are starting to develop symptoms of autoimmune disease, okay? So, medicine only knows one approach. Okay, the pharmaceutical industry is rampant. We always develop a new medication. The best treatments out there where all the research goes is for medication, right? But let's take a look at all of the different autoimmune diseases. There's a lot, about 24 that are really, really well known, but in reality, there's over 100. 100 different autoimmune diseases. I really find that hard to believe. So many of them overlap in their symptoms. Well, is it rheumatoid arthritis, or is it your lupus, or is it your celiac disease, or your fibromyalgia? Really? Does that mean that they're all really individual diseases? Or have they all started a process of inflammation within your body, and it can be attacking any different spot in different people? So look at this list. Rheumatoid arthritis, Hashimoto's or Graves' disease, and thyroiditis. I have those two, rheumatoid arthritis and Hashimoto's. That's what got me on this journey of functional medicine and working to find out the why. Because I was stuck in the medical system and I was a great patient because with rheumatoid arthritis, I didn't want to be crippled for the rest of my life. I didn't want my hands to start to deform where I was going to need to go on disability at an early age because I would lose function. And I'd bring that up with my rheumatologist, and for some reason, he didn't find value in that. The medication is going to control the symptoms. When it doesn't control the medication, when the medication doesn't control the symptoms, then we go to a new medication. That's what he did for me. That was it. He gave me the medication of his choice. And when I started to get worse, he said, well, when it gets really bad, I started to complain that I was having more pain in my right hand, specifically in a couple of joints. I was having difficulty bending my finger or straightening my finger out completely. I was in my early 30s. At that point, he said, well, when you can't move your finger at all, then we'll change your medication. So early 30-year-old woman, starting to have decreased movement from rheumatoid arthritis. The medication keeps some of the pain under control. I took ibuprofen 3 times a day to keep my pain under control. And he says, when you can't move it at all, then I'll do something about it. Does that sound like a good answer to you? Because it sure didn't sound like a good answer to me. But you know what? That was my push. That was my push to say, this system is failing me. I will be crippled by the time I am 40 because the disease or the medication does not stop the disease. I'm going to share with you again towards the end some of the triggers, some of the causes that I reversed that make it so all of my fingers work quite well, and I'm in my mid-40s now, and I don't take any medication for my rheumatoid arthritis, and I don't take ibuprofen anymore. I took a medication to suppress my immune system, plus I took ibuprofen 3 times a day, and I was in psoriasis. Those are all really common autoimmune diseases that you've probably heard of. 1 in 12 people have autoimmune disease, and it's only on the way up. 1 in 9 of them are women. This is double the number of people with cancer. Let that hit home. We're all afraid of getting cancer. Everyone thinks that that is the biggest fear, yet one of these diseases can be quite crippling. I know a woman, a friend of mine with fibromyalgia, who had to retire early because she couldn't walk. She couldn't stand the pain in her feet with every single step. It forced her to retire. Now she's doing quite well. Now she takes her dogs for walks every single day. She is retired. She's trying to enjoy her retirement, and her pain has gone from 10, 12, or 13 all the time down to a 1 or 2. Life-changing. But don't you agree with me that that's really disabling, debilitating, and affects your quality of life? Autoimmune disease is double the number of people with cancer. And for women, 8 times more likely to get autoimmune disease over breast cancer. It's not fun. So there's about 120 different autoimmune diseases, and it can actually be a leading cause of death in young and middle-aged women, 20 and 30-year-old. Think about the story I just started to tell you. Diagnosed in my early 30s, and then I was progressing, and then they just put me on stronger and worse medications that actually harm me, weren't helping me, suppress some symptoms. They were a Band-Aid for symptoms, those medications, but they were hurting me. So I really think about all of these autoimmune diseases when there's over 100, really a result of all of the inflammation, all of the wiring, the firing, the fireworks that are going off inside your body because of a signaling process going on. Because the medical system believes that autoimmune disease is just the body making mistakes, the only thing to do is to suppress the immune system with medications. Think about it. If you have autoimmune disease, you're probably on one of those medications. What does it do to you? It suppresses your immune system. But as I'm going to show you in the next slide, your immune system is really, really important. And in fact, it's really, really complex. It's got many different things going on, many different components. Yet our solution, oh, it's the immune system. It's not working right, so let's just squash it. Well, that doesn't make sense to me because it's missing the cause. Why is it doing that? Why is it out of control? They don't know. They don't care. They have a medication to suppress it. That's the treatment of choice. So this is your immune system. Let me see if I can move my picture here a little bit. We'll move that over to the side. This is your immune system. And the picture is just showing you all of the different organs that are involved in your immune system. Did you know that your tonsils are part of your immune system? Now think about if when you were a kid, you had your tonsils and adenoids taken out, or how common that surgery is. Oh, they keep swelling up, they keep getting infected. Guess what? When they're infected, when they're swollen, they're doing their job. What does the medical community do? We take it out. Well, they keep getting swollen, so we're just going to take them out. Your lymph nodes are part of your immune system, your thymus, lymph nodes underneath your arm and your groin. Your appendix is even part of your immune system. So is your spleen. And then your body makes part of the immune system out of your bone marrow too. And there's immune system tissue throughout the lining of your gut. Don't forget that. So what is the role of the immune system? It's supposed to protect you. Okay? When it protects you, it doesn't let you get cancer. And it doesn't, it kills foreign invaders, bacteria, viruses, parasites, all those types of things that can make you sick. If you're getting the cold every single time the cold comes around your office, or that your kids bring one home from school, you're getting sick all of the time, your immune system is pretty weak. It can't fight it off and prevent you from getting the infection. You're just sick, and you get sick, and you get sick, and you get sick. Your immune system helps to keep you strong and healthy. So how come when we have autoimmune disease, we suppress it? I'll tell you another story about myself, that when I was on those immunosuppressive drugs and I was being a good patient and I was getting my yearly womanly exam and having a pap smear, on those medications, I started to have abnormal cells when I'd have my pap smear done. And then I'd have to have another procedure to scrape off some of those abnormal cells. And this was happening for a couple of years in a row. So I was really starting to get worried, because those abnormal cells in the cervix turn into cervical cancer, right? I sure didn't want that. So being on an immunosuppressant suppressed my immune system, and it was no longer able to keep those cells in check. It was no longer able to kill those cancer cells right away and to eliminate them out of the body. Now, I never did develop any cervical cancer, but I got off of the immunosuppressants. And now I want to ask you a question. Do you think that I've had any abnormal cells on a pap smear in the cervix since I came off the immunosuppressive medications, even though I had a history of having those abnormal cells a couple years in a row? I haven't had any abnormal cells since that time. Being off of the immunosuppressive drugs helped my immune system get back to normal to fight those cancer cells. That's pretty dramatic, don't you think? Viruses, toxins, fungus, bacteria, parasites, all different kinds of germs and pollution. That's what your immune system is fighting for you, okay? We need our immune system. Okay, now I totally understand some of you may have been in this boat for a long period of time. You're on strong immunosuppressive drugs. I'm not saying just stop them, but we're going to get to the things that can start to change your life, okay? And this is where you need to start. My journey started with this book right here up in the top, The Immune System Recovery Plan. So when my rheumatologist told me, yep, when you can't move your finger at all anymore, then I'll put you on a stronger medication. So maybe I should have been thankful that I wasn't just put on a stronger medication, but at the same time, he failed me. The system failed me, and that prompted me to get my own information. That prompted me to study to study functional medicine. That prompted me to purchase this book by Susan Blum, The Immune System Recovery Plan. And it was my first step at helping myself. And it is the reason that I got on the health journey that I'm on, and that I'm as healthy as I am today. So what did I do? What did that book tell me to do? I stopped eating gluten. I stopped eating dairy. I stopped eating soy, and I stopped eating corn. I asked my husband if he wanted to do these things with me. After I read the book, I said, I'm going to change my diet. Something has to change because my arthritis is getting worse. And he said, sure, I'll do it with you. So we did it together, and let me tell you, it's so much easier when you've got somebody to support you, so much easier. So we both cut out all four of those things 100%. So when you tell me, oh, it's hard to give up gluten, I know. When you tell me, oh, I can't have soy, I'm allergic to soy, or maybe you have a hormone issue or a thyroid issue, it's so hard to give up soy. Yeah, I know. I've been there too. I've done it. I've done the hard work too. And when you look at your ingredient list, soy is in everything because they use it as an emulsifier. So you're going to find soy lecithin. Even though it's one of the lower ingredients, when you have autoimmune disease and you cut out these 4 very, very inflammatory foods out of your diet, your world is going to change. Want to know what happened in our story? We were doing this for 2 weeks Of course, a couple of pounds came off because this was our first food change when we started. It was going great. We were working really hard. We were doing it together. Within 2 weeks, my husband said his asthma went away. He said he stopped his medications. I said, what? What do you mean? I worked really hard to get you on the right medications to be a good, well-controlled patient with his asthma. He was on an antihistamine, he was on a steroid inhaler, and he had a rescue inhaler. 3 medications to control his asthma. After 2 weeks, no gluten, no dairy, no soy, no corn, he's like, yeah, I stopped them all. I haven't needed them. And I'm like, how could you do that? Why did you stop that all? You want to know what he said? He said, because I can breathe. Dramatic difference. Even being on the medications where he was controlled, and you never would have known he had asthma if I didn't tell you, to being off the medication and actually feeling like you can breathe. And that's what he did for me. And he took a deep breath. He's like, I can take a breath. I don't feel restricted. He used to not be able to lay on his side in bed more than 2 seconds. He'd lay on his side, talk to me for 2 seconds, and he'd go back to his back because he couldn't breathe on his side. After those 2 weeks of giving up those 4 foods, he can lay on his side. Amazing. I can sleep on my side now. So great. Yay. It helped his asthma tremendously. He has not taken one of those medications since we changed that diet, which is well over 6 years ago. Wow. 3 medications to 0 medications, and now we can breathe. That's amazing. But after 2 weeks, I said, I can't tell. I don't know if it's working for me. It worked for him. He could tell immediately. And some of you, when you start to change your diet, you're going to feel changes happen right away. I couldn't tell. I wasn't sure. And I was kind of mad. Like, hey, this is for me. My arthritis is getting worse. My rheumatoid arthritis is getting worse. Can't get my antibodies for my thyroid under control. This is for me. What's changing for me? Well, I kept doing it. I didn't give it up. We kept that diet going. And then it was probably about after a month, it dawned on me one day. I was walking into the bathroom and I paused and I thought, I don't think I took any ibuprofen today. Remember what I said earlier? I took ibuprofen 3 times a day, every single day, because I hurt. Even though the medication was controlling my rheumatoid arthritis, I still hurt every day. If I stood too long, if I sat too long, I hurt. Just doing normal activities, I constantly was hurting. And I walked into the bathroom and I literally had to stand there for a little bit. Did I take any ibuprofen today? I don't think I've even been taking any ibuprofen. That's when the light went on for me. My body was changing. It took a little bit longer for me, but my body was starting to respond and I wasn't automatically going to the ibuprofen because I hurt. My pain had changed. It was shortly after that that I cut my medication in half because I was afraid. I knew what it was like when I would miss my medication. I could barely move. So stiff, so sore, I could barely move. So I cut down my dose and I was still doing very good. And I still had okay energy and I still wasn't needing ibuprofen. So that's how I got off my medication. The next step was going off of the medication and I was still doing fantastic. So is that the only thing you have to do when you have autoimmune disease? No, I'm sharing it with you because it was a life changer for me. And again, gluten, dairy, soy, and corn are super inflammatory. It does not matter if you're allergic to them or not. They're super inflammatory. That's what we needed to change to cut out 100% to really make our disease processes start to change. The medication I was on wasn't stopping my disease. The medication my husband was on for his asthma was not stopping the disease. It was masking it. You have to get to the cause if you want your health to change, if you want your life to change. Now, we still avoid gluten. We pretty much avoid dairy. We don't do any soy. We do organic corn chips. So we don't follow that 100% anymore. But we do also some other things. So there's other things to take a look at. Food allergies. I want you to think about that. An allergen triggers your immune system. It triggers an immune response. If a child who's very allergic to peanuts eats peanuts, what happens? His face turns red, his throat starts to close, he starts to wheeze. I'm having my symptoms are worse, or my headache is worse, or I hurt more, or whatever it might be. So food allergies trigger the immune system. And if you're constantly triggering your immune system, how is it ever going to calm down? So if we go back to the medical approach, what do they want to do? They want to calm down the immune system. What I'm saying is that they're missing the piece of get rid of the cause that jacks up the immune system in the first place. And it's much easier to control the immune system. But it's not just suppressing and controlling it, it's getting it to work properly. Food allergies, super important. Infections. What did I say part of the role of the immune system was? To defend you, to fight off bacteria and viruses and fungus and parasites. Well, if you have an underlying infection, your immune system, again, constantly triggered. It's keeping it inflamed. EBV, Epstein-Barr virus, which is the monovirus, 90-95% of people in America have that virus, and it can come recurrent. It can become recurrent and trigger your immune system over and over again. There are 8 different types of herpes that can do the same thing. EBV is a herpes virus. So is CMV, cytomegalovirus virus. HIV, another example. Lots of different viruses go dormant in your body, but they may be low-lying infections. They're just staying under the radar, but they're still triggering your immune system constantly. Excuse me. How about gut infections? Bacteria overgrowth. We've talked about candida and yeast overgrowth with the yeast beast in your gut. It could be a parasite in your gut. All of those infections trigger your immune system. You have to take care of the cause. Before then you can see, what am I really left with? And a lot of people, when they take care of these causes, will find out that they never really had autoimmune disease. They were triggering their immune system. They had symptoms that looked like the disease, but it can be reversed. There'll be plenty of others of you who have been down this autoimmune road for so long. You truly have autoimmune disease, but getting rid of these causes will help you to control it much better with much less medication. Don't forget about Lyme's disease and all the co-infections that go along with that, or mold illness that we've talked about before too. Also think about stress. Every time we talk, I have to bring up stress because it is detrimental to your body. It triggers an emotional response, right? You're stressed out, you've been through emotional abuse, you're being abused, it's a toxic environment at work. So your body is constantly defending itself from those insults as well. It drains your body and your immune system is trying to protect you. Also think about the day-to-day chemicals that you're exposed to. Toxins, heavy metals, mercury, lead, plastics, the makeup you use, the lotion, even the toothpaste full of fluoride. There are so many different chemicals and toxins and the genetically modified things that are constantly, bombarding your body. So now all these inflammatory foods, and you're allergic to different foods. You've got these viruses, you've got infection in your gut, you've got Lyme's or mold, you're emotionally abused at home or at work, you've got heavy metals, you've got amalgams in your teeth, you put tons of makeup on and your body can't take it anymore. You got to start to clean up your life, okay? You got to get active, you got to get moving. And I know so many of you have been told it's in your genes. Oh, that's why. Oh, you're genetically predisposed. Oh, it runs in families. And although that may be true, that you can pass a specific gene down in the family, I'll tell you that all these things I just talked about on this page, it's the environment that turns it on. Okay? So I was predisposed to have rheumatoid arthritis. But if my life didn't go the way that it went with my pregnancies and carrying twins, which was really hard on my body, being in a bad relationship and working all the time and super stressed, just one thing after another became the right storm for me, with amalgam fillings, because I've had terrible teeth and lots of cavities when I was growing up, to other toothpaste and fluoride and all those things just became the perfect storm that I turned on that gene. But, they do studies on identical twins, and one twin can get a autoimmune disease and the other one doesn't. How does that happen? They're the same. It really depends on the environment. Now, if they have the exact same habits, if their lives were very similar, could they both get it? For sure, that happens. But don't blame your genes. All of these things trigger that autoimmune response to start happening, but you can change it. You can decrease that threshold. You can decrease those triggers. Like I told you, I used to be on an immunosuppressive medication that was putting me at risk for cancer cells that were growing. I took ibuprofen 3 times a day. Ibuprofen suppresses my immune system too. Now, I don't need ibuprofen because I don't hurt like I did. I'm not on an immunosuppressive drug anymore, and I don't have those cancer cells recurring like they were when I was only on the immunosuppressive drug. Those are things to think about. You've got some control. You've got some power. I've got 2 other books here for you before I close it out for tonight. Remember, write your comments, give me likes, share with me, give me feedback, share the video as well. I'll get back to some of your comments. I'm not going to answer them all tonight, but I will look back and see what you've commented on, and I'll type some comments. The Autoimmune Epidemic is a great book. Donna Nakazawa is a journalist who wrote that book, and the Walls Protocol is actually excellent. Terry Walls is a medical doctor, and she was in primary care, and she got diagnosed with MS, debilitating MS. She progressed. She did everything that conventional medicine wanted her to do. She was on numerous medications and studies, and she had to quit working. She was wheelchair bound. She was recliner bound. She became 100% disabled until she changed her diet. And then her world started to change. So the Walls Protocol is all about food. Terry Walls, Dr. Terry Walls, in her book tells you to eat 9 cups of vegetables a day, because that's what your body needs to heal and repair itself. So I tell you that instead of just telling you to get the book. The more vegetables you can eat and chew and steam and juice, the better health your body will be in. You will start to heal your mitochondria, which give you energy. You will start to heal your myelin sheaths, your nerves. You will start to heal and repair. She went from a fully functioning medical doctor to completely disabled and back again. That doesn't happen in MS. You're never going to find another person with that story unless they've done what Terry Walls has instructed them to do. And the other very cool thing is that now she's doing research on it to prove it. So it's not just hearsay. It's not just, oh, this is a diet fad. She proves it, and it's excellent work. So I wanted to share these resources with you. The Immune System Recovery Plan, that's where I started. It doesn't mean it's the be-all, end-all. I'm giving you some tools to start using, things that you can change on your own. But if you need more, then you need to seek out a provider who can help you navigate, do some testing, get your body to start to heal. But you can change your food. You definitely can change your food. So I want to thank you for joining me tonight. I really appreciate you being here. I'm sorry I couldn't say hello to everybody. When I have the screen up, I can't see who's on, but I do appreciate you being here and you following me and you sharing the videos so much. And so be sure to share it with a friend. Let me know if you have any comments or any questions, and I'll get back to you. And I will see you again soon. I hope you have a great night. Sleep well, because that's when your body heals, and I'll talk with you again soon. Thanks so much.